All right. Hello, everyone. My name is Christopher Ferrero. I am a public health student at Grand Canyon University, and I have the pleasure to be speaking with Mia, who is an EMT in New York City. Say hi, Mia.
Hello.
Okay, and we're here to learn about how different professional sectors can work together to improve population health. We're going to discuss how chronic conditions like diabetes show up in emergency care, how collaboration between EMTs and public health workers can improve outcomes, and what leadership and teamwork looks like in a fast-paced, high-pressure environment. So my first question to you, Mia, is one of the topics that my team worked on was type 2 diabetes prevention in Native American communities. From your experience as an EMT in New York City, have you seen how diabetes or other chronic conditions show up in emergency situations, and how do they impact the communities that you serve?
All right, so chronic conditions like type 2 diabetes show up in my patients every single shift. I have multiple. It's very, very common, unfortunately, and they can manifest in emergencies like hyperglycemia, hypoglycemia, DKA, and even stroke and cardiac events if they're left untreated. And, a statistic from the New York City Health Department is that like over 10% of New York City adults have diabetes. And that's definitely reflected in what I see every day on the street. And that is even higher in communities of color, like Black and Latino populations, and communities that have higher poverty rates. So poorly managed chronic illnesses like diabetes could be caused by a number of factors, such as like limited access to primary care, health insurance, food insecurity, the inability to afford insulin, and limited public health education. So, health outcomes at a pre-hospital level are very largely influenced by social determinants of health.
Yeah, and thank you for that answer. It's honestly a shame to see that in such a great city like New York City, that we are both from, struggle with certain situations like this, and with all the tax dollars that we pay in the state, how there is a lack of help for these people in marginalized communities, and hopefully in the future we can see something improve. So, yeah, so let me go to the next question. Public health professionals often focus on prevention, while EMTs respond to emergencies. What are some ways that you think the two fields can work together to improve outcomes for people with chronic illnesses like diabetes?
I think you brought up a great point that EMS is acute care while public health is preventative care. And I think there's a huge opportunity for the public health sector to collect information about patient populations and like the context of what they need and what useful interventions could actually look like through people like me, like EMS professionals, people who are the first point of contact for a lot of people experiencing health crisis. So, collecting data points from our patient population could help us identify community level gaps in access and help us create tailored interventions like mobile clinics, informational programs, nutritional programs, and even stuff like Medicaid enrollments, info sessions. I know personally the fire department who I work for, and I don't speak for, I just work for them. But they have like CPR mobile units that educate the public and even like private companies that work in the community about CPR. And there's other community um, level intervention, like outreach programs that the department does too, which is really cool. But that another thing that I think is really useful are community paramedicine programs, which I think could be more widely utilized in New York City, that would connect patients to resources or medications under the supervision of a clinician or a physician that would be reached via like telehealth, really, for their chronic health condition rather than just defaulting to emergency medical transport. So like the pre-hospital care that I do, because in many cases, for chronic illnesses like diabetes, it's not always warranted that they receive hospital transport. It might be just like an inability to access their medications on like a regular basis or, you know, inability to access public health education surrounding their condition. So, if public health officials and EMS personnel could share information, we can get really keen insight into the specific needs of the community, both in long and short term. And that could reduce negative patient outcomes by targeting the cause of repeated health emergencies and helping patients manage their chronic illnesses before they become life-threatening and would need someone like me to step in.
No, thank you for that answer. And I mean, I can tell that what you go through every single day, for your job, it's obviously like a lot of pressure for your team, for yourself now, and going into that, based off of how much pressure that you're under with often like different types of professionals. What leadership or teamwork qualities do you think are the most important when collaborating across sectors? Have you ever like faced any challenges when trying to coordinate care with other teams?
Yeah, coordination of care and continuity of care is something that affects, like, it's really at the crux of everything I do on a daily basis as the first responder. And I think some key qualities for facilitating that would be like respect, clear communication, adaptability. Um, as a first responder, as an EMT, I frequently coordinate care with clinicians at the hospital. So, like nurses, unit assistants, PCTs, and physicians. And then on the street, when I'm on a job, it could be any type of situation. So, situations that necessitate more than just EMS personnel would be what we call mass casualty incidents, and that requires, you know, new NYPD and fire personnel to also be on the scene in many cases, and those are different parts of public safety, right? And so we have to coordinate not only uh, exactly what we're going into, but also like information that we're getting that might be new
Hmm.
and even though we have different roles in this situation, we all have the same overarching goal, which is to protect public safety. So when it comes to a challenging situation, it's all about falling back on training to make sure that information is properly relayed through the appropriate channels. And so in my case, it would be through the medical branch, which actively communicates between EMS, fire, and PD on a scene about transport and triage operations that are ongoing. And with respect to hospital stuff, a lot of it is, we have different objectives. My objective is to get to a patient and transport them to a hospital. I'm pre-hospital care. And a hospital staff, especially emergency rooms in New York City, they have a limited bed capacity and we have an overwhelming population of patients on a daily basis. So they're battling, understaffing and just a limited space to accommodate these patients. And then through a public health lens, like we mentioned before, we're acute care, public health is preventative care, and we have a lot of different timelines that we're taking into consideration here. I work within the matter of minutes to hours, on my shift, and public health professionals work with respect to like months and years to see their goals fully realized. So while we're both equally valuable, we're coming from two wholly different perspectives, and we have to have respect for each other's timelines and objectives. But if we were to bridge that gap between acute care and long-term population health management, we could create really meaningful change for patients.
Yeah, really well said. Again, re-emphasizing your statement, communication is key between public health policymakers, politicians, even hospital workers, nurses, doctors, everything. It's very important for everything to work together so we can see change. And again, I'm gonna mention that again, New York City is a huge city. We deal with many different types of people, different types of backgrounds, different types of cultures, and they all suffer from individual health conditions. So, uh, truly, thank you for the work that you do for the city, for the state, and again, just thank you for sharing your experiences. And it was very valuable to hear how your field plays a huge role in addressing public health concerns, especially from the front lines. So, thank you again.
No problem. Thank you for having me. It was a pleasure.
All right, have a great night.
You too.
All right, so after talking with Mia, it really did open my eyes to how often she deals with these consequences like type 2 diabetes and other illnesses. She did mention that emergencies related to diabetes come up nearly every shift, especially in underserved communities. So it did stood out to me that many of these emergencies could have been prevented if people had better access to care, education, or things like insulin even. It tied right back to what we focused on in the CLC team on how social and structural factors play a huge role in long-term health outcomes. One of the things that she said that stuck with me still is how EMS works in the moment, responding to urgent needs, while public health is, more thinking about the long term, right? It takes years to see those results kick in. But even if the timelines are different, the goal is still the same, keeping people safe and healthy. That made me really think about how much we can learn about from each other, and if public health and EMS worked really close with each other, we can see great changes. She even mentioned things like community paramedicine and sharing ideas across sectors to help repeat emergency I'm sorry, to help prevent repeat emergencies, and to ensure that all people, and especially in New York City, everyone is protected. That's a level of collaboration that can make a huge difference into the world. Lastly, I would like to mention how this reminded me how we worked as a team within the CLC group. We brought a bunch of different ideas to the table, and we built off of each other's strengths, and we helped each other based off our weaknesses. So it is just like in an professional setting, communication and respect were everything, right? After this interview, my experience with this team, I just feel more confident leading in situations when people come from different types of backgrounds. So it's not about taking charge, it's about listening, adapting, and finding a way forward together. And as I keep on going into my career within public health, that's how I want to keep on growing. So again, thank you so much for your time, and I hope everyone has a great rest of your night.